Hey guys, let's talk about progesterone today. I think this is one of those hormones that we get a lot of questions about. And not surprisingly, the minute you hit 45 and above, you might notice that your hormones are just not the same. Like you are just not the same as a person, too. So who here knows that you already have low progesterone? And if you don't worry about it. We'll talk about it in just a second on what are the symptoms and what to look out for and how you can mitigate that. So there's various ways, there's natural ways of increasing your progesterone, like using herbs and a couple of supplements. And then we also have bioidentical hormones that are very safe. That's another one that I want to talk about today. So no, who here has noticed, like, ever since you turned 40, you're not sleeping the same, your mood is not the same, you suddenly start having more of the sort of anxiety, or you are the warrior, not like a warrior, like you go, but you worry, right? So that kind of warrior here I'm talking about. Have one of you experienced that? If you have, then share with us. And so Anita is saying, I have it all the time. Yeah, I have all of these. Yeah, so it's very normal that your progesterone starts dropping after age, actually technically after 35. That's why for any one of you who follow like the fertility guidelines, there is like 35 is like that age that's recommended to for safer, easier pregnancy. After that, due to there's various factors, but one of the big ones is that your progesterone starts dropping really quickly. So let's talk a little bit about that. And for those of you who are on our Facebook groups and such, I want to share a chart that will show you and explain why is it that even though both estrogen and progesterone drop, and I'm doing Instagram at the same time, so Instagrammers just stay with me, and I will just demonstrate it on using my hands and be mimicking around a little bit. So as you can see in the chart here, women at 35, some of, and this is of course talking about generically, right? Because there's just a broad spectrum view. Of course, there's women who start losing progesterone much sooner than that. But if you talk about a greater population, like the 35, 40, that's when the drop starts. 45 is really where you hit the point of progesterone dropping really quickly. So as you can see here, how the 45 mark, like there's a big dip, right? And this is the time when many of us are entering perimenopause. One of the ways you know that your progesterone is dropping is that your luteal phase becomes shorter. Luteal phase is the second part of your period. So from the time of ovulation till the time of your next period. Some of you might not even know when you are ovulating, and that's okay. That's, it's nothing unusual. But it's generally you start seeing your cycle becoming shorter. For example, right now I'm going through perimenopause, and my cycle has gone from the usual 28 to 29 days. I'm down now to about 22 days. And that's because of my luteal phase getting shorter. When you're going through a really nice, easy menopause or perimenopause and entering menopause, it doesn't have to be a big havoc. You can then basically your cycle will become shorter and shorter and then kind of slowly disappear. So that's the way you kind of slide into menopause rather than be going through this horrendous turmoil. So as you can see here, then in the chart, like women at 55, and I know many of you here are on that boat. When you're 55, look at the both hormones, estrogen and progesterone, have dropped, right? But look at how different it is in terms of the proportion of estrogen to progesterone. Even though both of them dropped, progesterone, the chart's showing progesterone dropped a lot faster, a lot more. And now the proportion of progesterone to estrogen is pretty uneven. So this is the reason why this is the only bioidentical hormone that we actually sell in our store, because it is the safe hormone. And I will talk about this in just a second. So let's go over some of the symptoms of low progesterone, and there is quite a number of them. And many of you know that estrogen dominance is one of the symptoms of low progesterone is when you become estrogen dominant. So you start having a lot of symptoms such as, for example, fibroids begin to grow a lot faster. You have got sleeping problems. You start developing lumpy breasts, right? So again, it's the estrogen to progesterone ratio that could be causing that. The symptoms, I'm going to just be going down the list. The big ones are hot flashes and night sweats. So many of you here, I know, are experiencing that. And progesterone, low progesterone can be a contributing factor, but I also found that if your inflammation is generally high and you have blood sugar balance problems, then the night sweats will become even worse. However, some women, if you're not inflamed, if your diet is pretty clean, you can reduce your hot flashes just by introducing progesterone. Insomnia, midnight waking, that's a huge one. On the reverse, one of the biggest benefits that women report in our community on using progesterone is better sleep. Like women will write to us and say, I don't remember having an amazing sleep like this in a very long time. So that's one of the really nice ones. You might also feel that ever since you hit that 45 mark, you have a lot more anxiety and sort of like restlessness, moodiness, and just feeling like very unsettled, very ungrounded. And you try to meditate and do breathing, and sometimes it helps. It helps for a while, but not for very long. And so progesterone is a very calming kind of hormone. Progesterone actually has got two big functions. Not only this, it's got more, but the two big functions is that it helps us to get pregnant. That's why the word progesterone is progestation. But here we're talking about a segment of women who are like, we are past the reproductive years, right? And anyway, this is not my specialty area, fertility. And so I look at progesterone also as a hormone that's a calming hormone. That's the hormone that helps you to fall asleep, to calm down, to be yourself, and to feel grounded. So let's see what else. We also have things like, having PMSs and PMDD can also be due to low progesterone. Weight gain around your hips and thighs and buttocks, including cellulite, that can also be due to low progesterone. And that's more so because of the progesterone and estrogen levels that are off, and you become more estrogen dominant. Women who are estrogen dominant tend to put on a lot of weight around their hips and thighs. Women who have metabolic disorders, so for example, high insulin levels, have high leptin levels, develop a lot of weight around their waist. Another one is fluid retention. So if you feel like, for example, suddenly you can't take your rings off, that could also be a sign of that. Osteopenia and osteoporosis, that's a really interesting one, you guys, because a lot of people think of calcium as the way to rebuild my bones. And it's a very, it's the dairy industry that has created that oversimplistic belief that calcium is going to solve everything. The truth is that, first of all, calcium needs vitamin D3, K2, manganese, boron, in order to get the calcium into the bone. But it's also interesting to see that even though your diet might not have changed very much, women who go into menopause and perimenopause also start having osteopenia, osteoporosis. Why? Because their estrogen and progesterone start dropping. So guess what? Estrogen is also a bone builder. It builds a scaffolding in the bone, where progesterone helps all these minerals and vitamins that I talked about to get deposited into the bone. So this is the reason why your diet might be the same as you were in your 20s, but now you have osteoporosis or osteopenia where you didn't have osteoporosis in your 20s, right? Why? That's because of your hormones. So progesterone can really help a lot with, like I said, rebuilding the bones, helping to deposit those minerals and vitamins into the bone. A few other things like pain, inflammation, excessive menstruation, hypersensitivity, migraine headaches before your cycles, that could be a big one. For those of you who have chronic migraines and headaches, start noticing, when do they happen? Is it during ovulation? Is it before your cycle, if you're still cycling? Even if it's irregular cycling, because if that is, then it's most likely hormonally related, and it could be estrogen or progesterone causing that. If you are having headaches and migraines for no good reason, then there's another reason to that. And we have written articles about that on our website, hormonesbalance.com. You can go and check it out. there's a whole bunch of reasons why you have headaches, and you can free yourself of those by not taking any medications. I used to have consistent headaches, and sometimes they were migraines too, and I got rid of them by addressing my food sensitivity. So in my case, it was gluten that was causing my headaches. Another one is decreased HDL or good cholesterol, which is also quite a big problem in women who are entering that time of the year, that age, the perimenopausal, menopausal, HDL starts dropping, and that could be oftentimes due to low progesterone, but it also could be because of low thyroid function. So you've got to be careful. You've got to figure out what it is. So what can change when you start supplementing with progesterone? And I'm going to talk about natural ways of increasing your progesterone, and natural as in through foods and herbs and supplements. And then we're going to talk about what do you do with topical progesterone. So, we've got a list of things, and Kamalani is going to post the link to our article, how to use topical progesterone, when and how, part 1 article. So what women report is that reduction of hot flashes and night sweats, improvement on bone health, reduction of PMS symptoms, reduction of, restoration of a healthy menstrual cycle. So for those of you who, for example, are bleeding a lot, which is also another pretty common problem with women in perimenopause, is something called flooding. It's basically the body's last attempt of stimulating the uterus and to produce eggs. And then when it doesn't happen, then it's pumping more and more the FSH and LH hormone, and you end up flooding. And so very heavy periods can be really scary for a lot of women. That is all part of going into perimenopause, but you can mitigate that by introducing progesterone. Improvement in quality of sleep, reduction of uterine fibroids and endometriosis. That's if your low progesterone is contributing towards estrogen dominance, then definitely can help reduce uterine fibroids and endometriosis. And by the way, in that article that I'm reading the list of benefits, we have studies that support every one of the claims that I'm making. So you can take a look at that and see what those studies are. And then we have reduction of pelvic pain, improved libido, increased thyroid function. It shows to increase your thyroxine, which is basically your thyroxine will be your thyroid medication, the synthetic one that a lot of you might be taking. Breast cancer prevention, possibly. There are some studies on that we are citing. Improved fertility, ovulation, if that's of interest to you. Progesterone inhibits mast cells, releasing histamine. So for those of you who are having histamine intolerance, histamine reactivity, histamine, it's a vicious circle with histamine causes estrogen dominance, additional release of estrogen. Estrogen also causes a release of histamine. So there's like this vicious cycle there. You can support it with progesterone, although I wouldn't say that's the only thing that should be done. Histamine is quite a complex condition, but definitely introducing some progesterone is going to calm down your body. Relief of pain and fibrocystic breasts, deeper and more restful sleep, mood enhancement, anxiety relief. It has got an anti-inflammatory effect. I used it post-surgery. I had 5 years ago, I had a bilateral hip replacement done. Trust me, I tried not to do it, but it was I didn't have much options at that point. It was a congenital, so from birth, defect of hips, and so right after the surgery, I did a lot of things, but including high doses of progesterone. That was really helpful. And then improving brain health, including there is a study there, and I know a number of people who've taken additional progesterone with TBI, traumatic brain injury, and it has helped them with including men with recovery from traumatic brain injury. So as you can see, there's a lot of really quite amazing benefits to taking progesterone. Now, the reason why I sell it in our store, but we don't sell it, for example, we don't sell any other hormones like estrogen or DHEA, testosterone, is because I feel like it's the safest hormone that you can use, and as long as you are monitoring your hormones every 3 to 6 months and getting either urine testing done through Dutch or saliva testing. There's a couple of providers. Then you're in a pretty good shape. Now, so let's talk about how do you increase your progesterone levels, right? And by the way, for those of you who are listening live, like, has any one of these symptoms resonated with you? Like what I'm talking about here, has any of those things happened to you? I'm just curious. So there is a couple of natural ways of increasing your progesterone. There isn't any specific food, like unlike estrogen, for example, there is estrogen in soy, in flax seeds, something called phytoestrogens, naturally occurring, very gentle estrogens, and they're pretty amazing at and helping you increasing your progesterone, your estrogen levels. However, there isn't anything found in food per se that can really help. One thing that is helpful is seed rotation method. So in the second cycle, there is no studies showing, but it's a method that's taught in naturopathic schools, and so we've been using that with quite a lot of people, a lot of women who report great benefits. So basically, using sesame seeds and sunflower seeds that happen to be high in vitamin E and zinc, right, can really help with producing more progesterone in that phase of your cycle. And if you don't have a cycle, that's okay too. You're basically giving your body zinc and vitamin E. The other vitamin that's hugely supportive of progesterone production is vitamin C. So that's something that I also recommend hugely. In fact, when COVID started, I upped my vitamin C levels to a point where I would get a loose stool. So I kept going. I think I went to as much as 3,000 milligrams, so like 3 grams of vitamin C. And only when I got a loose stool, that's when I backed off. And so my cycle has actually became longer. So instead of being 22 days, it went up to 24 days. And I think that was because of the vitamin C that I was taking. So again, one more time, vitamin E, zinc, and vitamin C are beautiful precursors for your native progesterone production. Some women like to do it this way and not go towards the progesterone creams or oils, and I want to be very respectful of that. So if that's you, that's something you can definitely try. In terms of the seed rotation, we have a seed rotation guide on how to do that. Kamalani, are you able to pull it out? The seed rotation guide that we have for folks, you can opt into that. So that's one thing. Now, there is an herb that is quite wonderful, and that is it's called Vitex, so also known as chasteberry. Many of you, I'm sure, know of it. And in Germany, for example, they use Vitex as the go-to herb, as a first intervention, if you will, for helping you increase your progesterone naturally, is putting you on Vitex. And that's all well and dandy. The problem I have found with Vitex is that quite a number of women actually can't tolerate it, and I'm one of them. Interestingly, we were working on a new formula, and so I was working with a formulator, a couple of formulators actually on that, and it turned out the formulator says, and she's also a naturopath, and she says, I actually can't do Vitex, and I'm like, me neither. Then why are we even talking about it? And then we did a poll, and it turned out that quite a number of women can't do Vitex. So when I say can't do Vitex, what I mean by that is that Vitex is basically, in my case, what it does is it gives me literally ovarian pain. And so I can feel my ovaries throbbing. And then I get mid-cycle spotting, which is actually another symptom I forgot to talk about, is if you get brown discharge in the middle of your cycle. So instead of like ovulating, you suddenly have seeing brown spotting on your panties. That could be also another sign of low progesterone. So in my case, it's like instead of helping me regulate or increase my progesterone, it actually does the opposite. I'm beginning to show signs of low progesterone, which is kind of, it's just kind of contrary to what it's supposed to do. But, I just want to remind you that as an herbalist and a nutritionist, I will say that, we have a saying in nutrition, for example, in nutrition school. I remember the saying is, one person's food is another person's poison. And I would say the same thing about herbs, is that one person's herb is another person's poison, potentially. I mean, poison as in, you're not going to die from it. But it could potentially, give you a paradoxical, more medical term is giving you a paradoxical response. Okay. So, Dorothy, half hysterectomy. What is your question, though? Are you asking if progesterone is okay to use with a hysterectomy? And so let me talk about the third option. And the third option is to use a topical progesterone. And actually, before I talk about that, let me talk about progestins, which are progesterone that are synthetic progesterones found in, for example, birth control pills. And that's highly recommended not to take. And many of you might have heard of that study, the Women's Health Initiative, that went very wrong. And they were supposed to run it for 25 years. They stopped it after 5 years because of the negative effects that women were having, including strokes, blood clots, and higher rates of breast cancer. And it turned out it wasn't estrogen that was a problem. It was the progestin that was the issue there. So that study was very unfortunate because it started demonizing all hormones for women, which is unnecessary because a lot of women do feel a lot better when they do add a bit of hormones. So why am I talking about hormones? I'm a staunch believer that setting yourself up for success, you're going to correct your diet first. And if you are new here, get one of my books, whether it's Overcoming Estrogen Dominance or Cooking for Hormone Balance. It's all about how to adjust your diet for the best hormonal success that you can possibly experience. And then once you do that and you're still highly symptomatic, that's when I think there is a time and a place for adding, topical hormones as well. So Flora is asking, what tests do you recommend to check progesterone and estrogen levels? Yeah, that's a good question. So so for estrogen, I'll start off with that. For estrogen, my favorite is Dutch, DUTCH. However, you need to interpret. You need somebody to interpret the results for you because it's for practitioners. Don't do it yourself because it's going to be overwhelming. And Flora, if you need some help, just email my team at support@hormonesbalance.com, and then we'll be happy to help you connect you with a practitioner who can help you interpret those results. For progesterone, the Dutch test doesn't do a very good job on progesterone. They do only an estimate. It's not an actual figure. So what we recommend is to do saliva testing. And there's a couple of labs, including ZRT, as well as Labrix, that can do that. Both can be ordered through your naturopath or functional doctor. There is also a website called the canaryclub.org, I believe. And you can order the saliva test there yourself. So for those of you who are interested in topical progesterone, we've got one in our store called Progest Pure. And so if you go to Welena, that's the Welena brand. If you go to welena.com, you will see there we have progesterone as one of our key products. So this is our number 2 selling product, kind of not surprisingly. The reason why we formulated that, let me just do this so everybody can see it. It's in an oil form. The reason why we did oil form is because I found that to be super quick to absorb. It's an incredibly clean product. First of all, it's derived from yams. Sorry, yams? Yes, yams, right? Not soy. From yams. It's non-GMO. The carrier oil is your good coconut oil, a fractured one. So it's basically your, so it doesn't smell like coconut in case you don't like coconut smell. We also have a tiny bit of vitamin E in it, so that it's in so it's a natural preservative. And then we also have a form of a sugar that just helps with a quick absorption. So as you can see here, my hands, it's like you can't even see that I've just put it on. That's how quickly it got absorbed. One dropful gives you 20 milligrams of progesterone, and that's one dropful gives you 1 milligram. So it's 1 milligram and it's 20 milligrams of UPS progesterone. And what else do I want to say on that? So there's a good question is coming in asking about let's do this question. Kamalani, the one asking about doing it through a pill versus doing that topical. So the question was, do you do that? What about oral progesterone versus topical progesterone? So that's a really good question. So progesterone is, you can take progesterone in the form of a pill, and it's going to work on the GABA receptors in the brain. GABA, for those of you who've been having like anxiety issues, you find it really hard to fall asleep because you were very anxious. GABA really helps you to calm down your brain, right? And so progesterone works on the GABA receptors. Apart from that, and so it helps you with your sleep, it calms you down. And that's the major benefit of pill. And when it comes to topical progesterone, all these other things that I talked about, the benefits of progesterone, including helping you increase your HDL, it doesn't go through, it doesn't help you with HDL cholesterol to increase it. It doesn't help with bone health and all these other things that I talked about. Katrina is saying topical doesn't go through the liver, which is also very true. This is yet another thing, one thing less to be putting that through oil. And so, sorry, through the liver, right? So when you're doing topical, the question was, where do you put it? So you can put it in, you can apply it on, the reason why you saw me apply it on my wrist is because whatever you feel like is a thin skin, so it could be here and you want to rotate the spots every 3 days. It could be on your inner wrist. It could be just around here because that's when you have very thin skin. You can put it also at the back of your neck. That's fine too. You can put it on top of your feet because that's when you have thin skin. Some practitioners are a fan of putting that on your abdomen where you have more fat for slow releasing progesterone, meaning that it's not gonna, so I like doing combination of both. Like for example, if I'm applying it at night, which typically that's when I use mine, is to do it on my wrist at first, and then do half of that, and then do the other half of my tummy. And then gives you, half of it goes pretty quickly through the, it reaches your blood pretty quickly and gets delivered into your brain and all the other cells. And so it basically it's a fast acting progesterone versus the one in the fat in the abdomen. Then what would happen is that it's going to be a slow releasing progesterone that might work throughout the night. So you can use a combination of those. Now, if you're still menstruating, you're only doing progesterone from your, so it depends on whether you're planning to get pregnant or not. If you're planning to get pregnant, you want to pretend like it is your natural cycle, meaning you only do progesterone from the time of your ovulation, so about day 14, day 15, until you get your period, which is your day 28, 29. And then you stop. The minute you get your period, you stop progesterone. If you don't care about getting pregnant, like for example, I'm menstruating and I tend to, my progesterone is definitely on the low side, then you do that for 25 days you do it for, if my cycle is 22 days, I do it 5 days after my period started. So for example, so your period is your first day, right? So on my first day, I don't do progesterone. Day 1, 2, 3, 4, 5, right? On day 5, I start doing progesterone, and then I continue until I get my period. So why do I do that? Is because I just feel calmer, and I feel like I sleep a lot better when I do progesterone. For those of you who are not menstruating, right, or you have irregular cycles, when you have irregular cycles, you do what I said just now, when you stop progesterone when you have your period, and then continue 5 days after that. If you don't have your period anymore, then it's pretty simple. You can just do anytime you like. Just take 5 days off in a month, okay? And then you can do it for the other 25 days. So, okay, so let's, I can talk a little bit about more, about other things on progesterone, but let's just maybe dive into questions. Kamalani, let's pull up some questions and then I can go on. Tracy's asking, does it help with weight loss or balance? So weight loss is a complex issue, right? Because it depends on why is a person having weight loss issues. Is it because of thyroid? Is it because of, is the weight around the abdomen, or is the weight sitting around the hips and the thighs? If it's hips and thighs, Potentially, yes, because the hip and thigh fat storage is estrogen dominance. And then by correcting your progesterone to estrogen ratio, potentially that weight can come down. If the weight is because of high, of parasites or high metals, heavy metal toxicity or things like that, then progesterone alone is not going to help. So I just want to be really honest and transparent about that. So it kind of depends on what is causing that weight imbalance. Is it possible to use too much progesterone? Hadley is asking. Yes, it is. So it's possible, and you would know it by feeling sluggish and very unenthusiastic about life. So your brain is not going to be, very fast and sharp. And so this is when you know you need to back off. I'm also going to take one question from Kristen on Instagram. Rough idea on how long to start noticing positive changes from the oil. So the incredible thing, Kristen, is that it's actually really fast. It could be as fast as 2 to 3 days. If it's like things like sleep, for example, or feeling anxious. If it's more complex things like, for example, shrinking a fibroid, which could be due to estrogen dominance, and you're balancing your estrogen dominance by balancing your progesterone estrogen ratio, then of course you need to give it a little bit more time. But I've seen women say that immediately after applying, they can sleep better. And that's already showing that it's working. Okay, let's take another question. If you are on hormone replacement therapy, is there a maximum dose for topical progesterone? Sarah, so you need to talk to your doctor, because I don't know what HRT you are on. If you're already taking progesterone, and what are your symptoms and stuff like that. So you need to talk to your doctor about that. So if you're adding on, definitely there's a conversation for a doctor. There's also a question about hysterectomy. So let me address that. Women who are taking who had a hysterectomy, one of the saddest things that I see, and together with my colleagues, and I talk about a lot of my colleagues who are OBGYNs and nurse practitioners who work with that population of women who lost their uterus due to hysterectomy, whether it's complete or partial hysterectomy. And let me just also mention that here, having a partial hysterectomy saves your ovaries, yes, but the ovaries get the major blood supply from the uterus. So when the uterus gets removed, the ovaries over time, and as soon as within 6 months to a year, actually die off. So they stop producing any hormones, in fact. Now, the sad thing is that the standard protocol for women after hysterectomy is to prescribe estrogen, which is really sad, because it's like, we need progesterone as well. And then unfortunately, that's not part of the protocol. So yes, absolutely, it is recommended when you have a full or partial hysterectomy to supplement with progesterone as well. Okay, next question. Can you take the oil orally? No, please do not. Was a difference? What's the difference in topical versus a prescription patch? So big difference. The prescription patch, if you're talking about a patch like the one that releases, are you talking about the one that releases hormones every day? You can't control the dose. With progesterone, you can. The other question is for your prescriber, is whether the prescription patch is Progestin with a synthetic progesterone or a natural progesterone. And I'm a very, very strong believer that we should not be touching progestins. Can you use it every other day, or do you have, if you don't have a period anymore? Brenda, so I already talked about that, so let's not, I'm not gonna repeat the same thing. Brenda, you can also check out the article that we talk about it. In the first part of the article, it's like, we explain if you're menstruating, when to take, if you're in menopause, when to take. Olga is saying, can you suffer really bad constipation when start using progesterone? I had to stop even 20 milligrams. So there are sometimes, not really. The typical side effect, if anyone has any side effects of taking progesterone, it will typically be things like feeling anxious, instead of being calm, right? So it's the paradoxical response, like the way I was telling you that when I take Vitex, it doesn't help my progesterone. It messes with my ovaries. So I wouldn't say constipation per se, but but if you do feel like there is definitely a connection, like meaning that the minute you stop progesterone and your bowels are moving in a regular way, then I would, I would just respect that of your body. And yeah, so in Vitex, oh, Sky is saying that's really interesting. Sky is saying Vitex makes me mean. That's really interesting sharing. So as you can see, it's not everything is for everyone, right? Yeah, I'm gonna take a look at Instagram and see, does progesterone affect hair growth and hair quality? If the hair loss of weak hair is due to estrogen dominance, then it can, by rebalancing the estrogen progesterone ratio, and then estrogen is not going to be dominant anymore, and then potentially it could. However, I feel like hair loss most of the time, or hair growth, it's more dependent on having too much of DHT, which is a form of a derivative of testosterone in women. As well as, so too high testosterone is typically due to high blood sugar levels. So that's something to look into. Low thyroid function is another one that can affect hair. So I wouldn't really make like a direct connection between progesterone and hair itself. Barbara is asking, does Vitex help increase progesterone? I already talked about that. It does, if you can take it. A lot of women are having side effects from it. So that would not be recommended. All right, let's go back to our Facebook group and see what questions we have there. If taking GLA maximum is necessary to take progesterone. So yeah, so GLA stands for gamma linolenic acid. It's a product we have in our store. And in case you're new to the community, our store is wellena.com, WELLENA. And we talked about GLA just a couple of weeks ago. So our GLA is derived from borage oil, which has got the highest concentration of GLA. GLA is really wonderful as a painkiller, pain releaser, inflammation, something that brings down the inflammation. I see this as having a different role to progesterone. So you can absolutely take that together, and they're not mutually exclusive at all. Priscilla is saying, 55, haven't had a period since November. I have bad hot flashes and carry much weight on my belly. I take high blood pressure meds and thyroid meds. Is it okay to take progesterone drops? Yes, you can. And Priscilla, one thing I would recommend for you to do also is get one of my cookbooks, Overcoming Estrogen Dominance or Cooking for Hormone Balance, both of them on Amazon. So just look for my name, like Magdalena Hormones, and the books will pop out. When you have a lot of belly fat, that's a metabolic issue. And so bringing inflammation down, bringing your blood sugar levels down is going to help you tremendously. Hot flashes are also due to, like I was mentioning before, low progesterone can be a contributor towards hot flashes. But I have found that if you have hot flashes, bringing progesterone up can help, but you get much better results if you also bring the inflammation down. So do the elimination diet, eliminate foods that are highly inflammatory, and that's covered in all my cookbooks. And then also balance your blood sugar levels, which you probably already have any challenge with, because that's why you carry a lot of weight around the belly. Hey, you guys, we can do another call on belly fat itself, like if this is something of interest to you, because I feel like that's an issue for a lot of women. Like, I've always been skinny and never had a problem, and then suddenly, boom, after 45, I get a belly fat. And belly fat, a lot of the time, is due to a metabolic disorder. I don't like the word metabolic, let's say, challenge. And why is because our cells are not as receptive to insulin as they were when we were younger. Like everything else, our liver is not as effective, our brain is not as fast, right? Our hair is not as strong and beautiful as it was before. But it's also your receptors are just not as sensitive to insulin anymore. So by having the same diet, suddenly you start having belly fat. Like, why, right? And the answer is that you basically need to learn how to make your cells a lot more sensitive to insulin, but on the other hand, also reduce the amount of sugar you're consuming. Okay, let's take another question, and then we can start wrapping up. I hope this is helpful, you guys, talking about progesterone. So For those of you on Instagram, you can head over to welena.com, and we have our progesterone that's available now. We had it on subscription only before. We managed to turn it over to a one-time purchase only, so you don't have to do subscriptions anymore. You can just get it and then try it out and see how it's working for you. One other thing is, Kamalani, let's just do, if there's any other, let me know in the private chat. If there is no more questions, then I can start wrapping up. I'll just mention one more thing, that having a low progesterone can also be correlated with stress. So for those of you, you might have, for example, noticed that when you go through a really stressful period, for example, suddenly your period of time, then suddenly your menses come, and it's menses from hell. Or you might feel that your breasts are a lot more tender, or you suddenly start having, lumpy breasts, right? And you're like, where did something come from? And the answer is that progesterone and cortisol are produced from the same mother hormone called pregnenolone. And so imagine the mother hormone is like the feeder, right? It's like the raw material, if you will, and it gets split up to progesterone and cortisol. And so when you're going through a time of stress, whether it's emotional stress, mental stress, physical stress, like women who run marathons and overexert themselves in exercise, whether it's a stressful time, so emotional stress, the body doesn't know the difference in those stresses and pumps all that cortisol for you to deal with stress during that time. And then there is insufficient raw material, if you will, left for producing progesterone. And so many of you, so if you feel like, you went through a difficult time in your life and you're showing a lot of symptoms of estrogen dominance, that's because your progesterone is on the low side. So then it's even a better time, or this is a really good time then to consider topical progesterone as well. Okay. I'll do one more last question and we wrap up. I'm taking estrogen reset and Welena progesterone, and no changes at all in my hot flashes. They're so horrible. I have changed my diet too. Is there anything else I can add to help? So Melanie, I don't know what else you're doing. Blood sugar balance is a really important one. Starting off, one of my favorite things to do, and that's transformed a lot of women's lives and hot flashes, is to start off with a savory breakfast, having no sugar whatsoever for breakfast. And a lot of our recipes in my cookbooks and our blog as well on hormonesbalance.com is our all savory breakfast. And so doing things like dinner leftovers, being very conscious how much processed carbohydrates are you consuming, and throughout the day, how much sugar you're consuming. If that doesn't work, one thing you could consider is going keto. So going like a healthy keto. And the healthy keto, one of my favorites is to follow Dr. Anna Kebeka with her green keto. I think she's got a new book now coming up, and I'm going to host her here next month. And it's called Menu Pause, like MENU, Menu Pause. And so going ketogenic might be the way to go. But yeah. And when you say change your diet, I'm curious, like, when you say change your diet, is like changing one or two things, or is it like, are you following our protocol in terms of being free of dairy, soy, corn, gluten, very importantly, and so really following that to the T, if you will, for at least for a period of time. Okay, so well, thanks everybody. I hope this was helpful to talk about progesterone, and consider getting the oil that's in our store, welena.com. But also, if you don't want to do progesterone topically, you can also enhance or build up your progesterone levels by stimulating your own body and adding things like vitamin E, C, and zinc into your protocol, and that should be helpful as well. All right, thanks everyone, and I will see you soon. Bye for now.